Is HPV testing recommended during pregnancy? Have you ever wondered if human papillomavirus testing is something to consider during pregnancy? It's a great question, especially since HPV testing plays an important role in cervical cancer screening. Persistent infection with high-risk types of HPV can lead to cervical cancer, so understanding the guidelines during pregnancy is essential. Generally, routine HPV testing is not recommended for pregnant women unless there is a history of abnormal cervical screenings or other specific clinical reasons. This is because pregnancy does not increase the risk of HPV infection or cervical cancer. Most HPV infections actually clear up on their own without any treatment. Invasive procedures and treatments are usually avoided during pregnancy to protect the developing fetus. Therefore, if a pregnant woman is due for cervical screening or HPV testing, it is often postponed until after she gives birth. However, if she has had an abnormal pap smear or is known to have a high-risk HPV infection, her healthcare provider may decide to perform HPV testing or a colposcopy during pregnancy. This careful monitoring is important since persistent high-risk HPV infection can be a significant risk factor for cervical cancer. Cervical cancer screening guidelines focus on the safety of both the mother and the baby. Non-urgent testing is often deferred until after delivery. It is crucial to ensure that any follow-up needed due to previous abnormal results is handled appropriately, especially during pregnancy. HPV vaccination remains a key preventive measure and is ideally recommended before pregnancy, particularly during adolescence or early adulthood. This vaccination helps reduce the risk of developing cervical cancer later on. For pregnant women, it is always best to consult with healthcare providers for personalized advice regarding HPV testing and cervical cancer screening. This ensures both maternal and fetal safety while keeping an eye on reproductive health. Understanding your individual medical history and risk factors is essential for making informed decisions during this important time.